My name is Dr. Diana Soladoye. I work at Nisa Premier Hospital, Jabi, Abuja, in Nigeria. I am a senior registrar in the Department of Pediatrics, and I'm a member of the West African College of Physicians, and also a member of the General Medical Council in the United Kingdom. I have about 14 years experience in taking care of children. Today I'll be talking about navigating childcare during the coronavirus pandemic. But generally I want to talk about taking care of children during any pandemic or emergency situation. Coronavirus, as most of us know, is a new disease which was first discovered in China in 2019. Thankfully, coronavirus hasn't affected children the way it has affected adults. In this pandemic, a lot of adults worldwide have died from coronavirus, and children initially were thought not to be affected by the disease, but eventually some children have been found to be affected by the coronavirus. However, the disease severity in children has not been as severe as what has been obtained in adults. It's a disease that knows no sex, preference, no race. All races, all countries have actually had cases of coronavirus within them. Like every emergency, those who are vulnerable are the ones that are most affected by a crisis situation, and therefore children are not left out, either from direct impact of the disease by illness or indirect impact of the disease. For example, access to childcare, access to welfare, child support, food, and other things that can make for the well-being of a child. WHO has defined health as not just the mere absence of disease, but the full physical, mental, and social well-being of an individual. So in a pandemic like this, our part as pediatricians is to ensure that our children are taken care of physically, mentally, and socially. I want to talk briefly about the clinical features of coronavirus, especially as it relates with children. It's a bit different in children than in adults, but as we said, it's a new disease, so every day new data is coming up about how this disease presents. There's no known cure for it at the moment, even though a lot of trials are going on. So in children, the disease can present as a mild disease, it can present as a moderate disease, or it can have a severe presentation. Usually, children come with normal respiratory symptoms like cough, catarrh, that's a running nose. The cough is usually dry. They may come with tiredness, diarrhea, vomiting, and severe respiratory distress. That's when it comes to the severe aspects. In America, there was also some rare presentations that were recently discovered, even though it hasn't fully been said to be coronavirus as the causative agent, but these children were found to have some presentation that looked like a disease called Kawasaki disease. However, the children were found to have positive antibodies against coronavirus and had contact with positive coronavirus patients. A lot of children, however, go asymptomatic. That is, they don't display any symptoms. Prevention of the disease is most important for anybody, and especially for our children. We don't encourage wearing of face masks for children who are less than 3 years because of the risk of choking, and we know that it's difficult to get a face mask to put on a child. However, children who are older and who can follow instructions are encouraged to wear a face mask, especially when they're going out of the home setting. We also advise parents to restrict going to public places where they could easily get in contact with patients that may be asymptomatic but are carrying the virus around. It's important for parents to seek medical attention as soon as possible when their children have any symptoms I have listed above. I know that in this time of the lockdown, a lot of parents have been skeptical about accessing health care because they think that the hospital is the first place to contact coronavirus. However, at Nisa Hospital, where I work, we have put a lot of measures in place to ensure that our children are well taken care of and they are safe. Part of the things that has affected children, not only in the hospital setting or urban areas, are also those children who are in suburban areas, those who are in the rural settings, because a lot of care has been neglected and a lot of focus has been placed on the care of adults rather than the care of children. So there are lots of problems that have come up and more are being envisaged. For example, the living conditions of people. Now you have a lot of people who maybe didn't have to stay at home. They are now staying in overcrowded areas, which is not good and spreads. It's an avenue for the spread of other diseases apart from coronavirus, for example, tuberculosis and other respiratory diseases. Also, family income has been affected, and what WHO has projected that child poverty is going to markedly increase at the end of this, as a result of this coronavirus pandemic. Parents' jobs have been either lost or their income has been greatly shortened because of this pandemic, which means that food and other essential items have been reduced that would be necessary to take care of children. Needless to say, the government in many areas in our country and outside the world has tried its best to ensure that palliative measures are being put in place to ensure that the impact of the coronavirus pandemic has been reduced, especially on children. Then, as I mentioned before, access to healthcare is also one of the things that has greatly affected children, childcare, and a lot of children who have chronic illnesses are not able to access healthcare because either the health services are closed in the areas that are close to them, or the staff are not available to attend to these children, or the parents are afraid to access healthcare. So things like routine checks, immunizations, and other preventive measures that go a long way to ensure that our children are healthy have been grossly inadequate because of the pandemic. However, at Nisa Premier Hospital, we have been open throughout this pandemic. Yes, care has been diminished a little. The influx of patients has also been reduced, but our clinics have remained, at least our outpatient clinics has remained open, and our immunizations have been going on so that babies who are born in this period are able to get their immunizations as at well when due. A lot of domestic violence has also escalated during this period. You have people staying at home, angers, tempers rising, people are used to going out, especially for children who, they're able to play around. However, because of this pandemic, you have to restrict them. So I know that childcare is one of the things that has been grossly affected during this pandemic. There's also this aspect of school. Schools have closed down for a long time, and right now nobody's really sure when these schools have been open. Thankfully, those in urban settings have been able to get their children to learn online, and a lot of schools have put platforms in place for children to learn, so a lot of learning has gone on. But those children who don't have electricity, who don't have electronic devices, who don't have or don't even know what it is to have internet connectivity, are left out of this. So we find out that there's going to be a gap in education for our children. We're hoping that this pandemic will be put under control very soon so that life can resume as usual. At Nisa Premier Hospital, we have made an online platform where children can access care through our telemedicine. It's Nisa telemedicine platform, so that even if a parent is afraid of coming to the hospital during this period, he or she can call any of our specialists and can be attended to. And for those who we think we need to see in the hospital, an appointment can be booked with the consultant or the specialist to come and see the doctor. We encourage hand hygiene. We encourage respiratory hygiene. Parents should teach their children how to wash. Children are very cooperative when it comes to things like this. You know, you have children coming to the hospital, they see sanitizers and they want to sanitize. They want to sanitize their hands. We've provided wash hand basins and soap so that children can wash their hands. And then we also make sure that even within the hospital setting, we practice social distancing so that we don't have too many people crowded in one place at the same time, and people are encouraged to wear their face masks. Children, as I said, who are over the age of 3, 4, 5 can use a face mask. And those who are coughing, who have any symptoms, are also encouraged to use face masks so that they reduce the spread of the disease. Definitely childcare in this period has been a challenge, but we are moving through, we are scaling through, and I must say that we have clients who are satisfied, who are happy to be able to come to the hospital and access care, both emergency care and even normal outpatient care. This is about what I'll have to tell us today about childcare. I'm open to answering any of your questions. If you have any questions, you can drop it on our Facebook page. Some will be able to answer now, and some we may get back to you later on during the course of the week to answer some of those questions that may be bugging your mind about childcare during this pandemic season. Thank you very much for listening.